as if they're walking out on the street untreated. How healthy is that for them? And how healthy was that for my son?
Gord Penner has been mourning for 20 years. His son Jesse, a star athlete in Port Coquitlam, was killed at a house party in 2006. He was caught in a large brawl involving 25 people.
Jesse helped this boy get up off the ground, and in the meantime he was pepper sprayed and he was stabbed 4 times.
The 16-year-old charged with his death eventually pleaded guilty to manslaughter. It was later revealed during prison hearings that Jesse's killer endured 2 significant head injuries in his youth and suffered severe mental health challenges.
This boy was seriously mentally ill, and I just like to know why nobody helped him.
Penner has long advocated for involuntary care, a policy that's gained more attention in recent weeks following a gruesome attack in Vancouver where a man was killed and another victim's hand was severed. Police say a suspect, now charged, had dozens of contacts with officers and appeared to be very troubled. Premier David Eby has now pledged to open highly secure involuntary care facilities at hospitals and prisons. 400 beds have been earmarked for people with brain injuries, mental illnesses, and severe addictions. A group of Metro Vancouver mayors are now backing the plan, including Coquitlam's Richard Stewart, whose daughter once entered a program.
She desperately needed involuntary care to save her life, to protect her, to protect others around her.
But some experts argue what's needed are more voluntary treatment options.
Unfortunately, the reality is from what I've seen is that forcing people into treatment rarely works.
They are creating a system that is very dangerous for us. And these impacts are well known and well studied.
Longtime drug user advocate Garth Mullins fears the policy will do more harm than good.
For drug users, it's traumatizing. And when we get released from these kind of places, we're going to seek to soothe that trauma with drugs. Our tolerance will have gone down, and the chances of us dying of overdose increases.
The Premier says regional facilities will include long-term care and housing. BC Conservative Party leader John Rustad is also pledging an involuntary care program of his own. Meanwhile, parents like Gord Penner wonder if involuntary care could have prevented Jesse's killing.
I sure would hope so, and I think about it a lot.
Jesse's killer is currently in jail after being convicted of killing another man. John Hernandez, CBC News, Port Coquitlam.